You're tuned in to The Andrew Lawton Show.
As some of you may know, and some of you may not know, I actually don't know what you know, I am a suicide survivor. About 10 years ago, more than that actually, at the end of 2010, I was nearly successful in attempting to take my own life. And as far as the reasons and the circumstances go, they're not particularly relevant to this discussion, except for the fact that I was dealing with, for several years, rather serious depression. So serious, in fact, that I thought that my life would be better served by being over than by continuing. Why this is relevant now is that the Liberal government is entertaining a Senate amendment to a bill expanding access to assisted death. And one of the amendments makes it so that someone whose sole issue is dealing with mental illness could access medical assisted death, could access assisted suicide in the healthcare system. Someone with depression, where we would normally say, well, here are all the reasons you shouldn't end your life, would now be given the means to do it. Now, the implications of this on the mental health care system are significant. The Canadian Mental Health Association, which is not generally a political body at all, has come out against this, saying that, well, we're a recovery organization. We can't accept legislation that views mental illnesses as irremediable, which is really at the cornerstone of assisted death. You have to have something that is not going to get better. Well, to go back to my own story as a suicide survivor, I was 110% convinced that there was no way my life could get better, and that's why I had to try to take my life. And this is so heartbreaking when I think of how the government is actually going down the road of suicide promotion rather than prevention. They are fostering what is really a culture that is the one we've been trying to fight against. Think of how many billions of dollars have been spent on mental illness awareness campaigns, on different treatment program, expanding access to care. And all behind that is the message to people that, hey, you're loved. We want to help you. We want to reach out and help you. So for the government to turn around and say, as they are saying, in effect, by accepting this amendment, that, you know what, if you want to take your life, you want to kill yourself, that's completely your choice. Have at it. Have fun. We'll even help you do it. Now, this is something that would never fly if they had put this in the original text of the bill, but I almost wonder if it was intentional, if this was orchestrated so that they didn't actually have to have any parliamentary scrutiny over it if they had put it forward right at the outset with this. I want to talk about the process and the implications of this with MP Garnett Genuis, Conservative Member of Parliament, who has done a lot of great work on this issue. Garnett, good to talk to you. Thanks very much for coming on today. And I should say that we were actually speaking about this on your show last night, on your Facebook page, and I'm glad to be back in our respective normal chairs here with you being interviewed by me. It's good to have you.
Well, thank you, Andrew. It's so great to be with you this morning.
Now, you've actually wanted to get people to tell their stories. That was part of why you had invited me to go on your Facebook stream last night, and I know you've done this with other people and are continuing to do it. You've launched a website, tellmetostay.ca. What is that?
We've reached out to people to ask them to share their stories, their personal stories related to mental health challenges and how they think C7 would affect them or could have affected them at past moments of crisis. And we've gotten over 70 stories already from Canadians who have personal experiences that they're prepared to share. So we had a press conference with a number of those folks on Monday. We're doing Facebook Lives on my page every night this week, sharing those stories. We're not going to have enough time to share all of them, but I really salute people who have the courage to come forward and share their personal experiences. And then just on the process side, because I think it is important that the government is trying to rush this through, relatively speaking, in the dead of night, that we had a bill that specifically excluded medical assistance in dying for those with mental health challenges. That was amended by the Senate, and then at the last minute, the government said, yeah, we're going to accept the Senate amendment. They decided to do that in a motion that was published late on on a Monday night, and then they expected the House to pass it the following day. Just totally outrageous, their expectation that between announcing this change in position and the adoption in the House of Commons, they could push that through within 24 hours. And they kept trying different procedural things to rush this through. and we've said no. We need to hear from Canadians on this. We did this. This is an issue that should at least be studied by a parliamentary committee. This is a dramatic change in how our society would operate, from one in which people with mental health challenges are offered suicide prevention to one in which people with those mental health challenges could be offered suicide facilitation by our public healthcare system.
And that is a very important point. And one of the things I raised when you and I were speaking last night is that I'm convinced that if a committee were to hear the stories of people who themselves are survivors of suicide, people that have lost someone to suicide, there's no way in a million years they could actually get on board with passing this. And it almost seems deliberate in that way for this to come about without that process, without the opportunity to hear from witness testimony.
Yeah, absolutely. The House of Commons committee that was studying this, by the way, the House of Commons committee study on it was quite limited as well, because the whole story of this bill is you have a particular court decision in Quebec, the Trudeau decision. Now, we think that should have been appealed to the Supreme Court. But in any event, the government decided to legislate on the basis of that decision. But then they dramatically expanded the issues that were in that piece of legislation. So the Trudeau decision dealt with the issue of reasonable foreseeability. The government removed a whole bunch of safeguards when they said we have to rush this bill through to make the court timeline. Well, if you want to worry about the court timeline, then how about you legislate in a way that specifically responds to the court and nothing else, instead of throwing a whole bunch of other issues? And then this is just the continuation of this story, which is the government adding in the mental health piece at this late stage with no House of Commons committee study on that issue at all, and then them again using the excuse of the court deadline, even though very clearly they're continually expanding the scope. The Trudeau decision had nothing to do with the mental health piece at all.
That expansion is key, because I remember when the very first legislation was put forward, there were all of these safeguards, and most people on the left were understanding that, we need to have these safeguards, we need to have these restrictions, and those have been continuing to break down. And now with the mental health case that we're talking about now, even beyond things that weren't even talked about, things that were actually laughed at when someone were to bring them up. Because I remember I brought this up the first time around and was told, no, we're never going down that road. That's never going to happen. And you have to be concerned about where it's going to go from here.
Yeah, absolutely. I mean, I've been a parliamentarian since 2015, so it's relatively short time. And yet I'm old enough to remember a time when Liberals said the safeguards they're now removing were so vitally important. I don't think the safeguards in the original bill were sufficient, and there were a number of proposals that we had put forward around that. But some of the very basic things, like a 10-day reflection period. The existing law has a 10-day reflection period. That reflection period can be waived with the agreement of the two doctors involved. So it's not a hard and fast rule, but it's kind of a default position that you would have a 10-day reflection period. This new version of the bill proposes to do away with the reflection period. It proposes to reduce the requirements for independent witnesses, and that in addition to creating a situation where people with disabilities, people with mental health challenges, are much more likely to be moved in this direction. But the current system still has problems with it. I mean, we already had testimony from people living with disabilities who were pushed in this direction, who repeatedly had euthanasia brought up to them, even though they had said they didn't want it. A case of a lady being told that she was selfish because her daughter didn't want to go in this direction. So people champion this on the basis of autonomy, but the social context in which that autonomy is expressed matters a lot. And now with the risk that people facing mental health challenges could be pressured or encouraged in this direction, or even that just the suicide prevention piece would be removed, it raises very serious concerns about the direction we're going, and so quickly from where we said we were in 2015-16. This would be a rare, exceptional case for terminally ill people to where we are now.
One of the things, when you mentioned the reflection period, as I understand it in this bill, one of the things that could happen is a same-day request that could be fulfilled. Is that correct?
Yeah. So and there's some different categories. So the legislation proposes to divide between the category of death reasonably foreseeable and death not reasonably foreseeable. And the concept of reasonably foreseeability has always been a little bit fuzzy because it doesn't explicitly refer to someone being terminal. Um, but this legislation removes the 10-day reflection period or any kind of time associated safeguard for those for whom death is reasonably foreseeable, so-called. So it does mean in that case that a person could request and receive euthanasia on the same day. And I don't think that makes sense. I don't think it makes sense that someone's worst day could be their last. That you could visit a family member in the hospital on Wednesday, think everything's fine, and then come back on Friday to find that, well, this was their request, and so we carried it out right away. I just, I don't think that's sort of in line with a reasoned consideration of what autonomy looks like, which is people being given the time and space to consider their options over a certain period of time.
You talked earlier about suicide prevention objectives, and this is something that's not lost on me. The government has put billions of dollars into this. We have billions of dollars put into this through charitable campaigns and efforts. We've got colored ribbon campaigns for suicide awareness and prevention. We've got committees, councils, ads, all of these things that are trying to serve the public by telling people to reach out for help if you want to take your life because of mental illness. And has the government given any indication of how it reconciles these two positions? On one hand, this, I say, vastly expanding public discussion about mental illness and suicide, and then this, which is saying that, you know what, if you're dealing with depression, that could be grounds for you to get a doctor-assisted death.
Yeah, there's a lot to unpack there. And has it been discussed? Has the government considered the implications of this? If they've thought about it, they certainly haven't talked about it because this has had very limited debate so far, and the government is trying everything they can to justify rushing this through without that kind of consideration and discussion. Andrew, one of the concerns I have is that people who are struggling with mental health challenges, are experiencing suicidal thoughts, may be less likely to seek help if they're concerned that that visiting their doctor might actually not lead to them being encouraged to live, but them being offered the option of death. I think that this undermines what we want to see, which is people in those crisis situations reaching out to support structures that can kind of help them through some of the things they're experiencing.
Let me just go to a bit of a civics question here. You have talked about the fact that this really bypassed the House of Commons committee and the rapid pace at which this was accepted by the government in the House from the Senate recommendations. What's the next step on this now?
Yeah, so on the civic side, the way our system works, bicameral system, every bill has to pass both the House and the Senate in identical form. So a bill can start either place. More often, legislation starts in the House of Commons. It's adopted in a certain form. It goes to the Senate. If the Senate adopts it, then it goes to the Governor General and becomes law. If the Senate amends it, then it's referred back to the House of Commons, and we have a motion on Senate amendments. And typically, in these cases, as we see right now, the government has a motion which agrees with some of the Senate amendments, maybe doesn't agree with some of those amendments, and modifies others. So in this case, it says the government respectfully disagrees with A and B, agrees with C, proposes the following changes to D and E. Something like that. That motion will be debated in the House of Commons. That motion itself could be amended. So the motion on Senate amendments could be amended. And right now we have a conservative amendment which seeks to change the government's motion on Senate amendments in terms of which amendments they're agreeing with and not agreeing with. Typically, in some form, the government's motion on Senate amendments will pass and then go back to the Senate. Because if the government agreed with all of the Senate amendments, then we'd be done. But if the government agrees with some and disagrees with others, then we still don't have agreement. So then it goes back to the Senate, and then the Senate considers whether to adopt the House of Commons kind of revised version, or to, in effect, make a counter proposal. So you can think of it sort of like a negotiation between the two chambers, where each one has to debate and then conclude on a position, and then send that position back and forth. Now, there are some complex procedures in the standing orders if we get to a point where there just seem to be irreconcilable differences. In the time I've been a member of Parliament, it's kind of at most gone 1, 2, 3, 4, House, Senate, then a House motion to concur some and others, and then back to the Senate for final agreement. That's what happened actually with Bill C-14, the original euthanasia legislation. We'll see how this unfolds on Bill C-7. But in a minority parliament, with some indication that some Liberals are uncomfortable with the direction of the government on this mental health issue, it's really important for people to seize this moment now to talk to their MPs and to ask them to rethink this facilitated suicide for the mentally ill proposal that has been added on to C7 at the last minute.
Well, I appreciate the explanation there, and also your work on this. Conservative MP Garnett Genuis. Always a pleasure, Garnett. Thanks for coming on.
Thank you, Andrew. Appreciate the opportunity.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.